All right, little quick video. Topic is marketing. So if you already have your own clinic, or you're thinking about going off on your own, you're thinking about doing the cash thing, or maybe you help out with the marketing at the clinic that you work at, here is a little insight on marketing, specifically talking about discovery calls and doing free consultations, and why you should be choosing one of those, and why I choose one over the other, even though the other one is probably the most popular in especially the cash-based realm. So let's talk about you're trying to increase your patient load. You just opened your clinic, or hopefully you're thinking about this before you open your clinic, and hopefully before you open your clinic, you've already diversified your skill set. So you're offering something that nobody else offers, and you're getting results that nobody else does. Because if you don't do that, you're going to be doing marketing until the day you die. So the things that I'm going to talk about here are things that you should be doing for definitely the first 2 months, probably the first 3 months. But after you get to the end of the first 3 months, you shouldn't be doing this anymore, because word gets out that you're that good and you do things that nobody else can. So the only option people have if they want to get better is to come see you. And the only way to diversify yourself is get through the shift so you're a 180 practitioner. So let's talk about onboarding or discovery calls versus free consultations. Okay, so discovery calls would go something like this. You have a website, you have your Instagram account with your links and bio type stuff. And one of the things that you're trying to do is to direct people into getting on the phone with you for a free 15, 20 minute, 30 minute, whatever it is, discovery call. Now on this discovery call, what you're going to do is explain why you are better than the competitors. And if you're a cash pay clinician, which most of the people that do this are doing cash, you have to describe why it's better that a patient come see you and pay cash than go to an in-network provider and pay a copay. So this is strictly sales, all right? All sales. Here's why I'm better. Here's why cash pay is better. Here's what I do. Here's why I spend a whole hour with you. So you're gonna have to break down what the conventional PT clinics or chiropractor or massage therapists do that you're competing with, and what you do and why it's better. And the only way you can do that on a phone call is to explain it to them, which becomes sales, okay? So typical cash pay clinician would say things like, I spend a whole hour with you, just you and me, for a whole hour. And people are supposed to think, wow, that's better than going to the conventional PT clinic and only being there for 45 minutes. So an hour with this guy by himself is better than 45 minutes at the clinic over here, where I see the PT for a little bit and then I see the tech or the aide for a little bit. Now I have to figure out which one of those is better. For me, somebody who values my time, I don't want to be with you for an hour. Okay, so if my dentist called me and said, hey, you've got a cleaning tomorrow, the payment it's the same payment whether you choose A or B, but A, you can come in and be done and we can get everything done in a half an hour, or B, we can do the same exact thing but a lot slower and waste your time in between by letting you read a magazine, or maybe putting you in a chair with a warm towel to make you relax, and we give you some bottled water, and we hold your hand and we do little things like that. It's going to be an hour. The cleaning is the exact same. So you're going to walk out with the exact same results, clean teeth, but one is a half an hour, one is an hour. I'm choosing a half an hour every single time. So you cash pay PTs that think it's important to spend an hour with somebody, and you're giving them the same exact treatment that they get over here for a half an hour or 45 minutes, I'm not picking you. If I'm coming in to have you stretch me, rub me, exercise me, needle me, cut me, tape me, hook me up to E-stim, all that stuff, and it takes you an hour to do that over here, but this guy can do it for half an hour or 45 minutes over here, and he's a $40 copay, and you're $200, I'm going over here, okay? So those are the pushbacks that you're gonna have to fight with them and convince them with your marketing skills and your sales pitch on a phone why it's better to go with you. Or you might be we have 180 practitioners that do onboarding calls. So what they have to do is explain, this is what I do with the 180 system, which is why that's different over here. So I'm going to have to explain neuromuscular physiology and then basically convince them that what I'm doing is more effective and better results than what they do over there with my sales pitch. Okay? So there is your onboarding discovery call. The other thing with this is you're going to have to take time out of your schedule. So you're gonna have to block out your schedule where you can do 15-minute calls. So let's say you have a block on your schedule every day for an hour. I'm gonna do these 15-minute calls to try to get somebody to come in. And let's say you close on half of those. So you're gonna spend an hour to get 2 people to come in to see you. Okay, and then once they get there, you're still going to have to go through patient education and restate a lot of the stuff that you stated on your discovery call. Okay, so does that work? 100%, definitely works. Not saying don't do this. I'm just going to say there's option 1. Here's option 2. This is what I've done for 20 years. I put on the back of my business card, call for a free consultation. On our website, call for a free consultation. On anything that we put out there, newsletters, whatever, call for a free consultation. If you've never seen us before and you've heard about what we do from your friends, teammates, classmates, whatever, call for a free consultation and we'll show you what we do, okay? So here's how my free consultation works. We have our visits here are blocked out for half an hour. So free consultation, we block out a half an hour. They come in, we explain to them the free consultation is the first 10 to 15 minutes. I'm going to take you back there. You're going to explain what's going on, what you've already tried. I'm going to give you a 10 to 15 minute treatment so you can actually feel what's going on, and I can describe to you what I'm doing as I'm doing it so you feel what I'm doing. I'm not giving you a sales pitch saying this is better than what you tried. I'm letting you feel this for yourself so you can say this is better than what I tried. Okay, so once I get done with that, so I'm going to listen to you, run you through a screen, do treatment on 5 to 6 different muscles, have you stand back up, run you through the part of the screen that you failed before, so you can feel the functional difference. You'll see the increase in range of motion, increase in stability, increase in strength, decrease in pain, and I probably never touched you where the pain was. So this proves to them that what I'm doing actually works. I don't have to sit there on a phone and try to convince them with sales gimmicks on a phone. They actually feel it live, real time. Then I say, okay, if you want to stay for the rest of the visit, now you came in complaining of shoulder pain and back pain and foot pain. We just did like tip of the iceberg with your shoulder. If you want to get to your neck and your back and your feet and your knees and everything and have me give you your exercises, all you have to do is stay for the rest of the half an hour. I'll do all that stuff and there's your first visit. And 99.9999% of the time they stay. So I just worked 15 minutes for free, but that turned into a regular visit, so I didn't work at all for free. It's a visit. I didn't have to block out my time. I don't have to jump on a phone. I don't have to be good at sales tricks because I am horrible at sales, okay? So I don't have to do anything. I let my skills and the patient's reaction and their results speak for themselves, okay? So there's the difference. And if you're doing cash, and you can have somebody come in and say, well, I went to physical therapy before, it didn't work. I went to chiropractic, it didn't work. I went to massage, it didn't work. I've been doing these exercises that I found online, those don't work. Now I can say, here's what they did from a physiological aspect, absolutely nothing. Here's what I did, got to the root cause, reversed the root cause, and now you have normal function. There's my sales pitch. I'm better than they are, and I just proved it in less than 15 minutes. And now I've got a patient who's gonna come back 4 or 5 times, and they're going to tell their friends about me, which is why I don't have to market. Okay. So you can either do the onboarding call thing, block out your time. You're going to lose half of that time because you're not going to get them all to convert. Then you're going to have to re-explain that stuff when they come in. You're going to have to learn how to be a salesperson, where if you just did a free consultation and you schedule a whole visit, but only the first 10 to 15 minutes is the free part, and you convert 99.999% of those people, you're not wasting your time, and you get conversions, and you don't have to learn how to be a salesperson, and you don't have to try to convince somebody on a phone that what you're saying is actually true, because guess what? If they already went to the chiropractor, they've already heard a sales pitch. If they went to massage, they've already heard a sales pitch. If they went to PT, they've already heard false narratives and nocebos out the yin yang, and now you're trying to battle with all of that over a phone where you can't demonstrate anything. So I'm not saying don't do discovery calls. You might do a combination of both. The nice thing about the discovery call is if they're on your website, it gives them a chance to directly contact you right now. So usually it's scan the QR code or go to this link and schedule the discovery call. So you've already got them to take a first step. So first step is huge. They take a first step by scheduling the discovery call. Now it's up to you to take it from there. Whereas if you're doing free consultations, the next step is call this number, talk to my receptionist, and schedule a discovery call. Okay, so some people might think that first step is easier for discovery, or not schedule a discovery call with the receptionist, schedule a free consultation. So some people might think that scheduling the discovery call is less aggressive and easier for a patient to comply with, so you get the first step done. I would still say that my bet is your conversion rate when you do free consultations is way higher. And what happens if you've got this chunk of your day blocked out for discovery calls and nobody calls? You just lost an hour, which in my world is 2 visits. Okay, so if you're charging $115 a visit and you just lost 2 visits, you just lost $230. What happens if that happens day after day after day because people aren't seeing your ads, they're not, or they don't want to click, or they're not seeing your Facebook page, they're not seeing your Instagram posts. So every time you have that chunk of your day not get filled with discovery calls, you just lost income where you could have had a live in-person free consultation. All right. So now remember, the only way the free consultation works is if you're doing something that they've never seen before. So if you're doing a free consultation, hey, come on in, I'm going to show you, here's our needling station, and here's where we hook people up to a machine and do this goofy E-stem thing over here, and look at our exercise equipment. They're going to say, yeah, that's all the same crap that I had at the other physical therapist. What are you going to do different? Okay, so if you're not doing something different and you're not doing something hands-on that they can feel immediately within 10 seconds, then don't do free consultations because you'll lose 100% of them. Don't do free consultations if you're doing conventional crap that they can get at any other clinician within a 10-mile radius, okay? If you've diversified your skill set, you've gone through the shift, you're doing 180, you can do a free consultation and close 99.999%, all right? So keep that in mind as you keep working on your cash pay practice, as you switch to cash pay, and understand that if you don't do the most important thing first, you will always lose. And the most important thing is diversify your skill set so you can give people results that they can't get anywhere else.